Impacts hundreds of thousands annually, yet it often goes underdiagnosed. Most recently, singer and actor Justin Timberlake publicly shared his Lyme disease diagnosis. And so we have Dr. Sandra Kemmerly joining us today to explain Lyme disease, symptoms, treatment options, all of those things. Sandy, your specialty is in infectious disease. So you work with things like this specifically. Maybe a reassuring note to start off with is that Lyme disease is not really common here.
Yeah, so the good news for Louisiana is that the Lyme disease, it's called a deer tick, is very, very little, and it really does not live in Louisiana.
Okay.
About the closest place that it is sort of central Mississippi, but it's very prevalent in the Northeast and along the Mid-Atlantic and up in the upper Wisconsin area. So people get bitten by the tick. It carries bacteria called Borrelia, and then the infected tick, after it's been attached to the human or an animal, can actually transmit Lyme disease.
Now, I know if we go hiking or camping with the kids, we obviously check and make sure that someone, hopefully you see if one is stuck somewhere. How long does it have to be attached to transfer that bacteria?
At least 96 hours. So that's the good news. So if you're checking for ticks every day and you're wearing protective clothing, long sleeves, long pants, socks, that will all minimize the risk of actually getting it. But the deer tick, if you're hiking, say, in Maine or the Northeast, is a tiny little tick. So you have to be very, very, vigilant looking for it.
Okay, so if you are traveling to the Northeast or even as far as central Mississippi, you want to be checking for ticks daily. Check yourself, check the kids. What would you notice if maybe you don't see the tick and it's been a few days? What would you notice going wrong if you need to get checked out?
Yeah, so early on you might feel like a flu-like illness. You might have fever, chills, muscle aches, joint aches, and then there's this classic rash. It's called erythema migrans, and that's pathognomonic for Lyme disease. And so if you see that rash, you really should seek medical attention soon. And then it's treatable. It's treatable with oral antibiotics, and so that really minimizes the risk of having any complications. If untreated, it can progress to more serious disease with manifestations of some neurologic problems, some arthritis, maybe even some heart conditions, Bell's palsy. But that again, once diagnosed, can be treated usually with IV antibiotics. And the treatment is very good, and it's people usually recover very, very well.
Okay, so because it's a bacteria, we have to use antibiotics to get it out of there. You can be preventative about this by trying to check for ticks really, really well.
Yes.
But if you miss it and you see that rash, get to someone immediately.
Yes, exactly. And certainly insect repellents are very helpful. You can put insect repellents on your clothes. You can put on your body.
The same stuff you would use for mosquitoes, like DEET?
Yeah, the stuff with the most DEET actually is good and helpful for ticks.
Amazing. Okay, so if you get to that point, we've all heard now, maybe you didn't before, but certainly with Justin Timberlake announcing this, we've all kind of been hearing and learning more about Lyme disease. Some folks have these conditions that kind of last longer, and you say once the bacteria has been treated, there can still be lasting things, but that's not from the bacteria anymore.
That's correct. There is now, a well-described and well-studied phenomenon called post-treatment Lyme syndrome.
Okay.
At once, people thought maybe it was just the bacteria wasn't adequately treated. It would give antibiotics for months on end, or even years and years and years. That clearly has been studied, and that's not effective. It more likely is a dysregulation of your autoimmune system to something, and it's well-described phenomenon. It's real. It's not fake. People aren't,
making stuff up or anything.
They're not making things up, but it's not very well understood. It can happen 3 to 6 months after a recognized infection or an unrecognized infection, and it can debilitate people, upwards to 6 months to a year. So it's a real thing.
So a lot of people don't have that complication, but something to look out for if you ever do know someone or yourself are going through that Lyme disease treatment. Doctor, thank you so much. I really appreciate all the information.
You're quite welcome. Thanks for having us.
All right, let's take a look now. Coming up, we've got Master Chef